Hello, and welcome to the virtual in-service for the Hamamatsu PDE Neo II fluorescence imaging system. Today we are going to cover functionality, draping procedure, ICG dosing, and recording protocol and troubleshooting. Let's start with functionality. The PDE Neo II system is made up of the PDE Neo II itself, consisting of the CCU, the camera head, and the remote controller, a monitor, and TAC recording system. The PDE Neo II monitor and recorder are all powered by one medical-grade power cable that coils neatly on the side of the cart when not in use. To power the system up, first ensure the power switch on the TAC is set to on and remains on, which will cause it to automatically power up when plugged in. Plug the power cable into the wall and turn the black power switch on the front of the PDE Neo II CCU. The monitor and recorder will automatically power up. Now that it's powered up, we are ready to drape the system. Open the sterile packaging and remove the PDE sterile drape. The sterile operator removes the sterile drape and holds it open by placing both hands inside the fold of the drape. The non-sterile operator grabs the PDE camera head by the cord and slowly lowers it into the sterile drape. As the PDE sterile drape is passed over the camera unit, the sterile operator grasps the drape by the exterior surface and unravels the remainder of the drape by the camera cable. Care is taken to make sure the drape is not stretched too tightly. The sterile operator now presses the foam firmly into the PDE lens and ensures a snug fit. The sterile operator fastens a sticky band as shown. The sticky band should be fastened where the camera cable connects to the PDE camera itself. The last step is to remove the thin film over the lens cover. Your system is now draped and ready to use. Ensure that the brightness, contrast, and intensity buttons are dialed into their default position where the colored dots are located on your unit's remote control. In this image, they are indicated by red slashes. Sitting over the surgical site, the surgeon or scrub nurse will press the color/fluorescence button to set the camera to the color mode indicated by the presence of a color image on the screen. Once in color mode, the surgeon can determine what field of view they need for the procedure by moving the PDE Neo II closer or further from the field until the desired field of view is achieved. Once the distance has been determined, twist the focus ring until the surgical field comes into sharp focus. Now, press the color/fluorescence button again to go into fluorescence mode. When preparing for ICG imaging, the room light should be turned off. Not all room lights will produce a significant amount of light in the near-infrared spectrum, but as PDE systems work by reading the near-infrared fluorescence omitted from ICG mixed with either blood or lymphatic fluid, any addition of light in the near-infrared spectrum will degrade the image and hurt the surgeon's ability to detect perfusion or lymphatic flow. Any significant amount of sunlight in the room will have a lot of near-infrared light and must be blocked from directly showing on the field. Once the lights are turned off, the circulator nurse can press the white light button on the PDE Neo II remote controller. That will turn on a filtered light that will visibly illuminate the field without hurting the fluorescence in the image. We are now ready for the ICG injection. For vascular perfusion application, the 10 milliliters of sterile water must be added to the 25 milligrams of ICG dye and mixed thoroughly. Concentration is now 2.5 milligrams per milliliter, or 0.25% by weight. The standard injection for imaging vascular perfusion is 5 cc's. It is optional to inject as little as 3.3 cc's to allow for 3 injections per 25 milligram bottle of ICG. The injection must be performed by the anesthesiologist as a bolus followed by a saline flush. Once the ICG has been mixed, it must be used within 6 hours to remain viable as a fluorescence agent and cannot be reconstituted with dye or saline. With the room lights off, the camera set to fluorescence mode, and held in focus at a steady working distance, you are ready to inject ICG and visualize perfusion or perform lymphatic imaging off-label. It is always possible right before injection to switch back to color mode to ensure focus is good at the desired distance and switch back to fluorescence mode to perform the imaging. While imaging, it is possible to adjust the brightness and contrast dials to optimize your image. As the brightness dial is turned up, the entire image will become brighter. As the contrast dial is turned down, the contrast between white and black will increase, making your fluorescence more dramatic, but making it more difficult to see the patient's anatomy. When imaging perfusion or performing lymphatic mapping, it is possible to press the fluorescence mapping key to increase the sensitivity of ICG detection and make ICG fluorescence more obvious by coloring it green instead of white. Recording on the PDE Neo II system is as easy as the touch of a button. The TIAC UR4MD recording device has a large internal hard drive as well as 2 USB ports that allow for simultaneously recording to a USB drive, or allows for the transfer of the internal hard drive after recording has commenced. To capture video, press the Video/Pause button. To pause recording, press the Video/Pause button again. To stop recording, press the Stop button. Photographs can be captured independently or while recording by pressing the Photo button. Troubleshooting. If the screen is white and washed out, look for sources of near-infrared light from room lights or sunlight. We refer to this unwanted near-infrared light as poison light. Sunlight will always be a significant source of poison light, but due to the scattering effect of near-infrared wavelengths, issues created by sunlight can be significantly ameliorated by ensuring that the sunlight does not have a direct path to either the field or the PDE Neo II camera head. Out-of-focus image. For best results, adjust the focus of the camera when in color mode and not in fluorescence mode. It is equally viable to hold the camera at one distance and adjust the focus ring as it is to adjust the focus ring and move the camera closer or further from the field till the image comes into focus. Sometimes the most effective method is a combination of both techniques. Can't see lymphs. Check to see if the injection site is fluorescing. If it is, turn on the image improvement for better sensitivity. If you still can't see lymphatic channels, they are likely too deep under the skin. Under normal circumstances, the PDE Neo II can penetrate roughly 20 millimeters into the skin. Fat density and pigment in skin can reduce how deep the PDE Neo II can see. If there is not enough contrast between fluorescence and the background, turn the brightness down and/or turn the intensity up. If neither of these settings adjustments significantly improve the image, you likely have an abundance of poison light. If the fluorescence has a halo effect, where the image is overly bright and washed out around the edges of fluorescence, then turn the intensity dial down until the halo disappears. Thank you for watching. You have now been in-serviced on the PDE Neo II fluorescence imaging system. Have a great day. Please feel free to reach out to your local Mitaka representative for any further clarification of these instructions. You can also always reach us directly at info@mitakausa.com.